Hello, today we have Haley. She's 15 years old and she's here for her well child exam. How are you, Haley?
I'm good. How are you?
Good. Haley, do you have any medical conditions or problems that you know of?
No.
Do you take any medications regularly?
No.
And do you know if you have any allergies to food or medications?
No.
No allergies?
No.
And Haley took her PHQ-9 screen and her GAD. She scored a 2 on each of those. She also had a recent visual exam 2 months ago with her optometrist. She is due for the hearing screening today, or hearing testing today. And she also had a dentist appointment that she went to about 2 months ago as well. So Haley, who do you live with?
I live with my mom, my dad, and my sister.
Okay, and how are things at home? Do you get along with your family?
Yes.
Okay, and do you work?
No.
Okay, and are you in school?
Yes.
How are things at school?
Fairly well.
Okay, good. And what do you like to do for fun?
I like to play video games.
Okay. And do your friends do they smoke, vape, or drink alcohol?
No, they do not.
And have you ever tried any of these substances?
No.
Okay. Are you in a romantic relationship currently?
No.
And how would you rate your mood on a scale of 1 to 10?
About a 9.
Have you ever had thoughts that life isn't worth living or giving up?
No.
And when you're in a car, do you wear a seatbelt?
Yes.
Have you ever been in a car with someone who is under the influence of drugs or alcohol?
No.
Hey, Haley. So I'm going to do a physical examination, Haley. Is it okay if I begin?
Yes.
Okay. So first I'm going to look at your hair. Okay. And have you had any issues with like dandruff or any rashes on your head or losing hair?
No.
And looking at your skin on your face, no lesions, no acne, no rashes. I'm looking at the ears, they are symmetrical. Any pain in your ears, or have you had any difficulty hearing recently?
No.
Okay. And then I'm looking at the eyes, they are symmetric, and the sclera are clear and white. The conjunctiva does not look inflamed. And the lids are free of any drainage. The eyelashes are evenly distributed. Go ahead, Haley, and look straight beyond me at that wall over there. Any pain in your eyes or any allergies?
No.
All right. And do you have any pain in your nose or discharge or any allergies?
No.
Okay. The nose is symmetric. She has several piercings. Any infections on the piercings?
No.
Lips look moist, pink, and she also has a piercing on the lower lip. Any issues with the piercing or teeth pain or problems chewing,
No.
bleeding gums? Okay. I'm going to go ahead and touch your forehead. Is that okay?
Yes.
Okay. Does it hurt when I touch here?
No.
Okay. Does it hurt when I touch here?
No.
How about here?
No.
Okay. And then can you open and close your mouth? Any pain when you do that?
No.
Okay. Any pain when I touch your ears here?
No.
How about here?
No.
Okay. I'm going to check your lymph nodes now. Any tenderness when I'm touching back here?
No.
Any pain or tenderness here?
No.
Okay. All right. I'm going to look in your ears. Right. The tympanic membranes are purely gray. They're intact. There's no impacted cerumen. And I'm going to look in your nose. The nasal mucosa is pink and moist. I don't see any erythema. Can you go ahead and open your mouth and stick out your tongue and say, ah? Okay. So the tonsils are normal in size and not hypertrophy. There's no erythema in the oral pharynx. And I'm going to look at your teeth. Smile big for me. Okay. Shows good dentition, no lesions. Open up and then lift your tongue. Good job. All right. So no lesions in the oral cavity, and the teeth are all intact, just good dentition. Okay, I'm going to go ahead and look at your neck. And the trachea is midline. There's no swelling on the neck, no rashes on the skin of the neck. And I'm going to touch your thyroid. Okay. Can you swallow for me? Okay. No nodules on the thyroid noted. Okay, can you turn your head against my hand? Very good. Now this way. Very good. Okay. And I'm going to press on your head. Does your neck hurt when I do that?
No.
Okay, good. And then can you turn your head to the right and to the left? Any pain when you do that?
No.
Can you look up at the ceiling? Good. Any pain?
No.
And now chin to chest? Good. Okay, very good. Go ahead and push your shoulders up against my hands, like you're shrugging. Good. Any pain?
No.
Alrighty. I'm gonna go ahead and listen to your heart and lungs. Is that okay?
Yes.
You can breathe normally. I'm listening to your heart. Okay. So the heart rate is regular and normal S1, S2 heart sounds, no rubs, gallops, or murmurs noted. I'm going to listen to your lungs, okay? When I put my stethoscope in your chest, take a deep breath in and out your mouth, please. Okay. Now on the back. Very good. Okay. And now I'm going to check your arms. Are you able to bend your elbows like this? Okay, push against me. Good. Pull against me. Good. Okay. Any pain in any joints?
No.
Okay. What about here? Okay. And I'm going to check pulses. 2+ radial pulse. 2+. Okay. I don't see any lesions on the skin, no rashes. And I'm going to check reflexes. So go ahead and just relax your arm there. Okay, +2 reflexes. Can I see your hands? Okay. And then can you bend your hands like this and up? Does that hurt?
No.
Open your fingers wide and close them. Okay, good. Any pain there?
No.
All right. No nail changes. Nail beds are pink. All right. And now your legs. Are you able to push against my hand? Good. How about this one? Good. Okay. Any pain in your knees or ankles when you move them?
No.
Can you lift your foot up like this? Okay, good. How about the other one? I'm gonna feel for pulses on your feet. Okay. And we have 2+ pedal pulses, or salus pedis. And I'm doing the posterior tibial pulses. 2+ posterior tibial pulses. I'm going to check your reflex on your knees, okay? Go ahead and relax. Be good, relax. Good. Okay. I don't see any rashes or lesions on the skin. The skin color is pink. No lesions. Okay, so now I'm gonna have you lay down. I'm gonna check your abdomen. And on inspection of the abdomen, I don't see any scars, any bruising. I don't see any obvious pulsatile masses. And I'm gonna go ahead and listen. Good bowel sounds. Okay, I'm gonna go ahead and press on your abdomen gently and let me know if there's any pain anywhere, okay? And I'm gonna go a little bit deeper in certain areas, okay? Take a deep breath. Okay. I'm gonna check here, deep breath. Okay. No organomegaly and no masses noted. Okay, Haley, I'm gonna check your pulses on your thigh here, between your thigh and your abdomen. Just pulses. Okay. Checking the popliteal pulse. Okay, good. All right, Haley, we're gonna bend your knee here and your hip. Does that cause any pain? No. Don't have any clicking? No. Other side? No. Okay, good. Okay, Haley, we can go ahead and stand up. I'm going to have you stand on one foot and try to balance there. Okay, and the other. Okay, good, perfect. Okay, Haley, I need you to close your eyes. I'm gonna be standing right here. Perfect, okay. Haley, now I'm gonna have you walk this way 5 steps. Okay, and back. Haley, do you know how to duck walk? Okay, so we're gonna squat down and you're going to take 5 steps just like that. Does that hurt? No. Okay, good. All right, you can come back and have a seat over here. Haley, just a couple of questions. Do you know what today's date is?
May 19th, 2026.
Okay, and do you know where you are?
And my home.
Okay, good. And can you spell the word world backwards?
Yes. DLROW.
Okay, Haley, I'm gonna draw a number on your hand, on the palm of your hand, with your eyes closed. Tell me what number this is.
3.
Very good. Okay, Haley, so do you have any questions for me right now?
No.
All right. So it's important, Haley, that you continue to eat healthy, especially if you're going to be starting any sports. Make sure you're always wearing your seatbelt like you do today, or until today. Anytime you're in a car, always wear your seatbelt. If you're on a bicycle, make sure you have a helmet. If you ever feel that you need to speak with someone, find a trusted teacher or your parents. I can also give you resources if you ever need to speak to anyone about how you're feeling or your mood. Today, you will need a couple of vaccines or immunizations. I recommend the flu shot since it is flu season. And then also we have the HPV vaccine that we're going to be discussing. That you haven't gotten it before when you were 11 or 12 years old. So we can get the first dose today. So we'll discuss that as well. And then we will see you here in a year or sooner if necessary, but for your next, checkup. Okay, thank you.